Hey, it's Friday. It's TGIF Doc Talk with Dr. Go.
Hello, everyone, and welcome to another episode of Doc Talk, where we talk about health, aging, and everything in between. Today, we're diving into a topic that may sound a bit uncomfortable at first, but it is truly one of the most important things that we can do for ourselves and our loved ones, and that is called advanced directives. So, what exactly is an advanced directive? In simple terms, it's actually a document or an instruction that enables somebody to state their healthcare wishes in advance. Now, this is especially important for situations where the elderly would pretty much may no longer be able to speak, make decisions for themselves in the future. Now, what are such cases? The one that comes to mind is Parkinson's disease, for example, where an elderly person slowly loses the ability to control their body and eventually loses the ability to even speak, swallow properly. And when decision making is required, they're not able to do so. Another of such situations is Alzheimer's disease, where it's a form of dementia, where at the early stages, the elderly person may still be able to make decisions, but as Alzheimer's progress, it will reach a stage where they will not be able to make decisions for themselves. So an advanced directives is basically an instruction today for the future, 5 to 10 years time, when they are not able to make the decision themselves, whether they are physically or mentally not able to. Now, what are the typical decisions that they need to make? Things about life support. Do you want to resuscitate? If you end up in a situation where you need cardiopulmonary resuscitation, CPR, do you want that to be done? Do you want the healthcare professionals to stick a tube down your throat to support your breathing artificially? Do you want to undergo dialysis? Do you want to undergo life saving surgery at the age of 90, 95 years old? Or would you prefer just to have a comfort care like oxygen, intravenous drips, maybe some painkillers to ease your passing? Now, these documents are also something like power of attorney, but more specific for healthcare. That's why it's called advanced directives, where we typically appoint an individual, a trusted person, it's usually a family member that you can trust, to make these medical decisions on your behalf. Of course, some individuals may not have family members, and that's why it's important for you to appoint somebody that you are able to trust, whether it's a good friend, a younger, maybe a family friend, somebody that you definitely can trust. Now, the key point here is that it's not about trying to predict the future, but rather it's trying to be prepared for the future. Now, why is it so important and why would this matter so much, especially for our elderly loved ones? And the reason is because as we age, our health can become very unpredictable. As I mentioned, some people live up to their 90s with full independence. They can still think, they can still act normally. And now, under such circumstances, of course, you might say that the advanced directives is not important. But most seniors, when they reach a certain age, dementia will creep in or certain chronic illnesses will creep in. And why is it important? Is because when this kind of crisis happens, right, the family often have to make very, very quick and emotional decisions. And without an advance directives from the individual himself or herself, it may cause a lot of family conflict. One child might say, I want to go all out, whereas another sibling might say, let's just do the more compassionate thing and let him or her pass comfortably. And it may result in guilt and disagreement. And these decision makings may come from different beliefs of the individual, different financial status of the individual, and also life circumstances or different beliefs. So an advance directives for an individual actually is a very useful tool to prevent conflict and uncertainty. It provides a very strong clarity to the healthcare team, to the family members, and it gives a lot of peace of mind to the family because the family will know that whatever decision made based on the advance directives is honoring the loved one's true wishes. And it also ensures that the medical care aligns with the elderly person's values, whether it's focusing on prolonging life or just comfort or simply just having that kind of dignity at the end of life. Now, some people might think that advanced directives means that you're trying to give up and the doctors won't treat them anymore. And this is actually a very big misconception. In fact, advanced directives is more about empowerment and it's not about surrender. Now, this is a very, very important thing. Advanced directives is about empowerment and it's not about surrender because it ensures that you receive the care that matches your beliefs and your priorities, not just what that is medically possible. So, under any circumstance, it's always easy to say, yes, I want to go all out, but the repercussion of going all out can be extremely painful. It can unnecessarily prolong an individual's suffering, and sometimes for the elderly, this is not what they want. So, if you are a caregiver who is caring for an elderly parent, or if you are someone who is getting old yourself, it's good to take some time to think and talk about this. And you can sit down with your family, your doctor, and discuss what matters most. You can ask about what are the typical norms of advanced directives, whether it's usually they come in 3 different levels based on the degree of invasiveness. So the lowest one is comfort care, which is your oxygen, your intravenous drips, your pain control. The next level usually is minor surgery or dialysis. And even beyond that, it would be things like CPR, intubation. These are the more advanced. So when you discuss about advanced directives, you will go through these various levels of invasiveness of treatment. And that's where you decide what is it that you want and what is it that you don't want. And typically, we try not to wait for a hospital admission or an emergency only to decide. The best time to plan is when you're well and when you're thinking clearly. So, guys, just to remember, an advance directive is not just a piece of paper, it's actually a gift of love, clarity, and respect for both yourself and especially for those who care for you, your children. The last thing any elderly person wants is when they are in a very difficult situation and they're already at the point of no return and their children are just battling each other out to make a decision on your behalf. So that's usually what the elderly person does not want. I think that's pretty much it. And thank you all for joining me on this podcast. And until next time, take care, stay informed, and let's keep the conversation going. Thank you.
Click the share button to share this episode to a friend or a caregiver and hit follow to keep up with our latest episodes. Thank you.